This is chapter 16, part 3. We were talking about how, for some organizations and businesses, using this drug testing approach would not work out very well because it's too expensive. Um, we were last talking about colleges and high schools. The University of Michigan had researchers that found virtually identical rates of illicit drug use in schools that had drug testing programs compared to schools that did not have the drug testing uh, programs. And these schools were similar too. So what's the evidence that we draw from this, or the conclusions, I should say, that we draw from the evidence here. And that is that it doesn't seem like, there might be some schools, high schools, colleges, um, that might want to do drug testing to discourage, to deter drug use, drug abuse among their students. But according to this research, that it didn't seem to be effective. It didn't deter. It didn't scare these kids away from using illicit drugs because they had similar use rates compared to schools that didn't have any testing at all, that were just regular schools operating in the normal way. Some studies have found some deterrent effect of drug testing on illicit drug use in schools, but the overall picture is mixed. So we probably can't make any strong conclusions about that, but we can definitely, I think, say that the research does not give us a great deal of confidence that the drug testing would work in schools. You might think it would be. I mean, it seems to me sort of, again, deterrence is kind of an appealing idea, but it doesn't always work as well as we think it might. Now, some anabolic steroids can be taken orally and others through intramuscular injections, but abusers often administer a combination of both types in a practice that they call stacking. Make sure in this chapter, like any chapter, to be familiar with these terms because terms make great quiz questions. So stacking, I mean, it's a combination here of taking these anabolic steroids by mouth, swallowing pills, and also injections into the muscles. Hardcore abusers may take a combination of 3 to 5 different pills and injections simultaneously, or they may consume any steroid that is available with a practice referred to as shotgunning, with the total exceeding perhaps a dozen. So you see a lot of this sort of abusive use of not even just one type of anabolic steroid, but maybe multiple at the same time. So that's pretty intense use there. In addition to the complications that result from so many types of steroids being taken at the same time, multiple injections into the buttocks or thighs with a 1.5-inch needle which they'll, could be called darts, points. Again, they have these sort of jargon among drug users. These are painful and inevitably leave scars when you're using these injections, these needles all the time. If the needles are shared, as they frequently are, the risk of hepatitis or HIV contamination is significant. Anytime you have people sharing dirty needles, that is a recipe for trouble for the spread of serious diseases like hepatitis or HIV, AIDS. Steroid abusers often follow a pattern that's called cycling, in which steroids are taken for periods lasting from 4 to 18 weeks. The on periods being separated by off periods of abstinence or going without the steroids. So cycling on and off, just keep that in mind. Now, unfortunately, what happens is when the drugs are withdrawn, you stop taking them for a while, the newly developed muscles tend to shrink up. You lose some of that muscle growth, throwing the abuser into a panic that his or her body is losing the gains that have just been achieved. So you work hard, you're using these drugs a lot, and you're working out, lifting weights very aggressively. You build up, you see growth, you see improvement, and then you lose it during these down periods, and that sets off an unhealthy psychological effect where users don't like to be off of the steroids because of the muscle loss that can occur. In addition, it's not even just muscle loss. In addition, abstinence from steroids can lead to signs of depression, such as problems sleeping, lack of appetite, and general moodiness. So we know that the effect of steroids or testosterone can be sort of like, and can give you sort of an up feeling, a positive and action oriented feeling. So the absence of that could lead to sort of more negative emotions like down feeling, like depression. All these effects encourage a return to steroids. So again, when you're having negative things happen when you're off the steroids, you're motivated to get back on them. Frequently in ever larger doses. So here we see this escalation of use, like you see with other drugs, with other addictive drugs, and generate a craving for the euphoria that the person felt while on them. So again, you can get positive euphoric feelings from these anabolic steroids like you do from some other drugs. You know, people who didn't know any better might just think it's purely a muscle growing type of drug, but it actually, there's these psychological, emotional components to it as well. A variation of the cycling pattern is the practice of pyramiding. An individual starts with low doses of steroids, gradually increases the doses over several weeks prior to an athletic competition. So a lot of, these are competitive athletes who are trying to get to their peak condition. And then they'll taper off the use of these steroids entirely before the competition itself in an attempt to escape detection during drug testing. So pyramiding. Just think of it as gradually increasing up to close to the time of the competition, then cutting it all off, hoping that you can pass the drug tests. However, pyramiding leads to the same problems during abstinence and withdrawal of cycling, except that the symptoms occur during the competition itself. So the moodiness, the depression, the lack of sleep, etc. A major problem associated with steroid abuse is the potential for an individual to believe that his or her physique will forever be imperfect. So you get this interesting psychological effect of this sort of ongoing perception that your body, your growth, muscle growth, your physical condition is not what it should be, is always falling way short of the ideal of the perfect. And so it does, I've got here in the notes that it's in a kind of reverse anorexia. It does sound similar to conditions we see with bulimia or anorexia, that has been called muscle dysmorphia. Dysmorphia, that's another term, muscle dysmorphia. Just remember that it helps to figure out some of these terms if they have these like Greek and Latin roots. So dys means like bad, and morphia is morph means shape. So it's like bad shape. Some bodybuilders continue to see their bodies as weak and small when they look at themselves in the mirror, despite their greatly enhanced physical development. So you might have these guys who are really muscular, looking at themselves and perceiving themselves to be small, weak, undeveloped, because you get this distorted view of yourself, a little similar to what you see people with anorexia going through. People who are extremely thin, like a skeleton, and yet they still think they're overweight. Peer pressure at the gyms and clubs is a factor here in never being satisfied with the size of one's muscles, but it's becoming apparent that societal pressures play a role as well. So, what do they mean by this? The societal pressures? Well, certainly we know that they cite this example, this sort of good example, a concrete example. If you examine GI Joe action figures from decades ago, um, that GI Joe was in good shape, but was not particularly heavily, muscled. like now. Now the GI Joe action figure in the current day is much more ripped, is much just extremely muscular, and uh, so you can see that the argument they're making here is that to impress others with muscular development, it's got to be more extreme nowadays than in past decades. Just as the Barbie doll has been criticized as setting an impossible ideal for the female body among girls, male-oriented action figures can be criticized on the same basis for boys. These sort of unrealistic expectations for muscle development. Traditional estimates of substance dependence among steroid users ranges from 13 to 18%. But more recent studies indicate that the prevalence rate may be somewhat higher. So again, if even if at 13 to 18%, those are fairly high numbers that you often see with these. Say for example, alcohol. That the common statistic you'll see that of people who drink regularly, about 10% of them have a dependency problem at any given time. About 1 out of 10. So these numbers are a little higher than that. That you get quite a bit of dependence uh, among these anabolic steroid users. In an internet survey, about 1 in 4, so there we're talking about 25%, of bodybuilders using steroids reported that they were taking larger amounts of steroids over a longer period of time than they had originally intended or planned on. So they're using more and more than they thought they would. That they needed increased amounts of steroids to achieve the desired effect. Sounds like a drug abuse problem. You need more and more. You're using a lot more than you thought you were going to. Or that they experienced physical or emotional difficulties, problems when steroids were discontinued. So again, kind of withdrawal problems, withdrawal symptoms, similar that you see to other drugs. So 1 in 8 admitted that they had resumed steroid use to relieve a problem that occurred when they stopped. Okay, so we're going back to it, going back to the steroid use because when you don't have it, there's some problem and you're trying to get away from that problem, so you start using it again. By the present day DSM 5 guidelines, about 1/3 of them would meet the criteria for moderate to severe substance use disorder. So again, these are if 1/3 was an accurate number, that's a lot. That's a pretty high. As drug abusers go among users, that's a pretty high number. The high dosages of anabolic steroids taken upset the delicate balance of hormones and other chemicals that are normally controlled by testosterone. So of course you're messing with your hormonal balance when you're taking these heavy amounts of anabolic steroids. The primary effect in men is for the testes gland to react to the newly increased testosterone levels in the blood by producing less testosterone on its own. So in other words, the body very often is designed towards balance and equilibrium. And so if all of a sudden the body is detecting and the testes glands are detecting that, wow, there's a lot of testosterone floating around in the bloodstream, then what happens is that the testes will cut back and stop producing so much testosterone, which we sometimes call T for short, right? So the testes will produce less T because there's a lot in the system. So you get that sort of reaction from the body with a lot of these drugs that normal products will be reduced in response to the presence of all these artificial products. And that can cause some problems. So the gland is getting the incorrect message that its services are longer needed. I don't need to produce testosterone much anymore because there's too much already in the system. As a result, the testicles will shrink in size, and a lower sperm count can lead to sterility, to the inability to produce children. It's reversible for most men. If you drop the anabolic steroids, the testosterone levels will come back to normal levels, the sperm count come back to normal levels. But in a small number of cases, it can be irreversible, where you can lose your ability to produce children, where you could be low testosterone naturally, and not able to have those normal levels of T after this abuse of anabolic steroids. Now, another side effect that sometimes occurs is that the male breast can enlarge, a condition that's called, another one of these terms, it's a good term to know, gynecomastia. It just means the growth of the breast, because steroids eventually break down into estradiol, which is a one type of estrogen, female sex hormone. And so that estradiol can cause the breast to enlarge. So that can be a side effect of the abuse of these anabolic steroids. Other related consequences include frequent, sustained, and often painful penile erections, a condition called priapism, and an enlargement of the prostate gland. And if I'm not mistaken, the textbook didn't say this, but I'm not mistaken, that could also increase the risk of prostate cancer as well. Now, another side effect, severe acne, particularly on the shoulders and the back, can result from an increase in the secretions of the sebaceous glands in the skin. So, acne, another side effect. Other testosterone related effects include two changes in hair growth patterns: more facial hair and accelerated balding. So, you could lose your head hair more rapidly under the effects of these anabolic steroids. Now, among women taking anabolic steroids, the dramatically increased levels of testosterone in bodies that normally have only trace amounts produce major masculinizing changes, only some of which return to normal when steroids are withdrawn. So, of course, testosterone is the male, predominantly male sex hormone. Females have testosterone in their bodies, but at about 1/10 the level that males have. So, if you take those very low levels and pump them up with antibiotic steroids, that's going to have some pretty strong effects on the female body. Large doses of anabolic steroids take their toll on the liver, which is a very important organ for sort of screening out these metabolites, breaking down these substances and processing them. So it's going to put a lot of stress on the liver there. The principal result is a greatly increased risk of developing liver tumors. Let's stop here and we'll continue on in the next segment.